So here's my story of how I was diagnosed with oral cancer. Back in 2024, early, I got a couple cancer sores on the side of my tongue. Didn't think anything of it, except for after months, it didn't go away. In October of 2024, I ended up in the hospital because I had E. coli infection in my abdomen. I had to have surgery and I was in the hospital twice, hooked up to IV antibiotics and antifungal medications. Now, you would think that with all of those strong medicines, the sores would go away, and they didn't. I also found out during that hospital stay that I was diabetic. I was extremely overweight, about 230 pounds, and my doctor told me I had to make some serious life changes. And I did. I started working out, I started eating better, deliberately trying to lose weight. Well, with diabetes, you have to go to the doctor every few months to follow up with your A1C numbers and, all that. So, the first one, I didn't mention anything to the doctor because I was more concerned about my diabetes and my recovering from my abdomen. So, in February of 2025, I mentioned something to her in one of my follow-up visits. She brushed it off, told me I needed to go see a dentist for something like that. Okay, well, I already am taking time off to go to all these doctor appointments, and I had, time off for when I was recovering from the surgery, so I didn't go to a dentist. In May of 2025, I had another follow-up visit, and I told her, the sores are severe, can you please look at them? So she briefly looked at my mouth, and she said, I'll be right back. She left and came back with a book. And she opened the book up and pointed to some pictures of somebody's tongue that looked similar to mine. She told me I had oral lichen planus, erosive, and that it was autoimmune, so there was no cure and no treatment. And that we would just have to address the symptoms, the cancer sores, as they occur. So she also told me that with oral lichen planus, that it would turn into oral cancer. So it was going to be something we would have to watch. She gave me some steroid cream to put on my tongue, which didn't work, and sent me on my way. In September, by this time, the sores were starting to spread along the side of my tongue and under my tongue. I made an appointment to go see her because my throat was starting to swell shut. I couldn't talk very well. I couldn't even swallow my own spit. So she gave me a strep test. It came back negative. And put me on prednisone for 5 days. That worked. The swelling went down until the medicine was gone. Then the swelling came back. So I called and asked for a refill. And she gave it to me. Again, 5 days. Once it was gone, it came back. This went on for like 3 cycles. Finally, she said prednisone was not a long-term solution for this, and she was going to have me go see an ENT for a throat scope to see how far down my throat the lesions that she was seeing were going. So the erosive oral lichen planus was spreading down my throat. So I went to this ENT, and I was all nervous about having something stuck on my throat. and he took one look at my mouth and stepped back, opened the door and told the nurse, "You can't throw the scope, don't bring the stuff in." He couldn't do anything. He closed the door and turned to me and said, "I'm not doing anything today. I'm not doing anything because you need a biopsy as soon as possible." He says that is beyond oral lichen planus. That looks cancerous. He didn't say we need to rule out cancer or we need to figure out what's going on, something a little more gentle. He said that looks cancerous. So he left the room to go try and figure out when he could get me in for a biopsy. And the nurse came in and she started going over the instructions that I needed to do for this biopsy. I don't know. I wasn't even paying attention to her. My head was spinning. I'm thinking, oh my God, here we go. Do I have cancer? She looked at me and she said, "Are you all right?" And I'm like, "No, I'm not." She goes, "It'll be okay." She goes, "If it is cancer, we will send you to University of Wisconsin Hospital, where you have some of the best oral cancer surgeons around." So as I was going home, trying to figure out how I was going to tell my husband that this wasn't just cancer cells, that wasn't oral lichen planus, that this could be cancer. I called my mom because my husband was asleep. I was numb, I was spinning. Then the doctor called me and told me that I could get in on Friday. He was going to do the biopsy. But because he didn't want to disturb any of the sores in my mouth any more than he had to, I was going to have to be awake for it. He couldn't put me down, put me to sleep. So Friday came and I went to the biopsy just out of my mind, scared. And he did the biopsy. And, it was local anesthesia, but he took tissue from the side of my tongue and under my tongue. Took about 15-20 minutes and I was done. But then the waiting began. I had to wait for the results, and he thought maybe the results could be in by Monday. Well, we didn't get the results until Wednesday. I got a notification on my phone that my chart had my test results ready. So I opened it up, and it was a report, like the medical terminology, but in the one box it said final conclusion, or something along that line. Squamous cell carcinoma. Carcinoma is cancer. Now, I knew there was a chance. Now I have biopsy. But until you see it and you realize you have cancer, there are not words that can describe how I felt in that moment, or what I needed to do. Because now I realize that there's a cancer. Have I had cancer all this time? Has it spread to where I'm gonna die? These are all things going to my head. So I was at work. Obviously, I ran up to talk to my bosses, and I eventually went home. And as I was driving home, the doctor called me. And his tone was so much different than it was in the couple other meetings I had. It was very urgent. He said that the cancer was in my tongue It was under my tongue, on the floor of my mouth, and that he was going to send me to the University of Wisconsin to get the best surgeons. He said they're usually really good about getting new patients in right away, and that I needed to get in for a CT scan as soon as possible to see just how far spread the cancer was. So I got home, I told my husband, and I cried and cried and cried. And I got in for a CT scan then a few days later. I got those results that the cancer was internal. Most tumors on tongue go outward. Mine was going inward, and it was taking up almost all of my tongue. So I got my appointment made with my new doctor at the University of Wisconsin. My next video, we will go into that chapter. I hope you join me.